Once upon a time, there was a happy family of a father, daughter, and grandmother decided to go camping. They were happy until the daughter heard her grandmother coughing vigorously. "Hello, my grandmother is having an asthma attack. Please help her. She has a past history of severe persistent asthma, and she hasn't been monitoring her big flow levels at home. We are in a beach camping on 9th Street.
Got it. Keep your grandmother safe until we arrive. Are you her granddaughter?
Yes,
Can I ask you a couple of questions about your grandmother?
Yes, you can.
What's her name and age? And can you tell me what happened exactly?
She's DG, 65 years old. She felt like she couldn't breathe, so she took her asthma medication that usually controls her acute attack, but it seemed that it didn't work this time.
Do you remember the name of the medication that she took?
Yes, it's called albuterol.
You said that she has a past history of severe persistent asthma and doesn't regularly monitor her peak flow levels at home. Is that right?
Yes, doctor, that is right.
Thank you. Please wait until we arrive. TJ, a 65-year-old woman, she has a past history of severe persistent asthma and doesn't regularly monitor her peak flow levels at home. She was on a camping and fishing trip. Then suddenly she had a difficulty breathing, uncontrollable wheezing and tightness of the chest, which is likely a consequence of inhaling the barbecue smoke. On the way, we gave her 2 albuterol nibs, 2.5 mg each and 0.5 mg subcutaneous epinephrine.
Okay, thank you. I got it from here. Nurse, please measure her peak flow rate.
Okay.
TG demonstrated peak flow of 175 liters per minute, while her baseline during the last of his visit was 480 liters per minute.
Okay, give her a supplemental oxygen by nasal cannula until she achieves an oxygen saturation of more than or equal 95%, and then continue the albuterol at 2.5 mg every 1 hour as needed, please.
Okay, doctor.
Asthma is a chronic inflammatory response of the airways that is characterized by airflow obstruction, bronchial hyperresponsiveness, and an inflammation. The symptoms of asthma are difficulty breathing, wheezing, and cough. The most common form of asthma is allergic asthma, and it's associated with environmental allergens such as plant pollens, house dust mites, chemicals, or like in our case, the smoke. The pathogenesis of asthma result of episodic bronchoconstriction and a chronic airway inflammation. So the treatment depends on quick relief of the bronchoconstriction by using short-acting beta-2 agonists and the amelioration of the underlying inflammation by using corticosteroid as anti-inflammatory agents. Her physician wants to add an oral corticosteroid to increase her peak expiratory flow by 60% above of the baseline for at least 60 minutes. So he decided to consult the pharmacist. The pharmacist contacted one of her friends who work in medicinal chemistry department to take his advice.
Hi, Ibrahim.
Hi Sarah, how are you?
Good. How are you doing?
Great, thank you.
Ibrahim, may I ask you for advice regarding which drug to use for my asthmatic patient?
Sure. What's your patient's condition?
She has a severe persistent asthma, and today she came to emergency department with an acute attack. Her peak flow was 175 liters per minute, while her baseline of last of his visit was 480 liters per minute. Her physician asked me if he can add an oral corticosteroid to increase her peak expiratory flow by 60% above of the baseline for at least 60 minutes. Do you know what's the corticosteroid can I added from these 3 corticosteroids? Prednisolone, triamcinolone acetonide, or betamethasone sodium phosphate?
Okay, first of all, you need to know the structure-activity relationship of hydrocortisone. the fundamental structure of glucocorticoid and mineralocorticoid activities. Structure-activity relationship of hydrocortisone. Hydrocortisone is composed of 4 fused hydrocarbon rings, A, P, C, and D. The numbering starts from the ring A. The essential functional groups are the pregnant skeleton with an all-trans backbone, the ring A known system, delta 3,4 on ring A, a hydroxyl at carbon 11, and the 17-beta ketol side chain. Now, after you have understood the SAR of hydrocortisone, I will explain briefly the differences in SAR of the 3 agents that you chose. The first one is prednisolone. There is an additional double bond between carbon 1 and carbon 2. This double bond has increased the glucocorticoid activity and reduced the undesirable effect of mineralocorticoids because it would lead to salt retention and edema. In addition, this extra double bond increased the duration of action due to its ability to retard the metabolic reduction. There is no ester mask, the 21OH. So prednisolone, the free alcohol form like this one, is used for oral administration for long-term control asthma. The second one is triamcinolone acetonide. It has the acetonide function group at 16-alpha and 17-alpha, which decrease its mineralocorticoid activity. The 9-alpha fluorine group increase both glucocorticoid and mineralocorticoid activity by preventing metabolic oxidation of the 11-beta hydroxyl group to ketone, and by the inductive effect which increase the dissociation of 11-beta hydroxyl group, and thereby increasing the ability of the drug to bind by hydrogen bond with its receptor. There is no ester mask, the 21OH. So, triamcinolone acetonide is effective as an inhaler for long-term control of asthma, not for treating an asthma attack that has already begun. Finally, beta-methasone sodium phosphate. It's a disodium salt of 21-phosphate ester of beta-methasone. It's a prodrug due to masking the carbon-21 hydroxyl group and needs to be activated by phosphatase enzyme. A 16-alpha methyl increase the anti-inflammatory activity and reduce the salt retaining remarkably. Also, it's introduced to the patient through a parenteral route due to its ester form. I would say beta-methasone sodium phosphate as a drug of choice due to its injectable form, which is the most suitable form to treat TGA's asthma attack in emergency department, and to achieve a response therapy above 60% of baseline peak expiratory flow sustained for at least 60 minutes, while prednisolone and triamcinolone acetonide used orally and as inhaler respectively, which make them unsuitable routes for drug administration in TGA's situation that need a rapid effect.